So now this is another case of melanoma. And we've taken that shave biopsy here. It's been cut into 3 pieces, and we're looking at those. And again, top epidermis layer, dermis layer, and then we don't actually see the fat layer here on a shave biopsy usually. So in this case, there is melanoma in situ. And I'll show you a stain in a minute to help you see it better. It's a little harder to see here. There's a lot of melanoma cells in here, but to the untrained eye, you may say there's just purple and pink. Don't worry. Even my medical students, a lot of times when they first start looking at pathology, they're like, it's all just purple and pink. I can't tell anything. It takes a lot of time and good teachers to help you make sense out of what we're seeing under the slide. But I promise you, there is melanoma in situ in here. But as I get over to this area, something changes. Now we have melanoma cells not just up in the epidermis, but now the melanoma cells are beginning to invade down into the dermis, past that bottom layer of the epidermis and into the dermis. And the problem with that is in the dermis is where all the blood vessels and the lymphatic vessels are. The epidermis gets all of its nutrients from the dermis. All the blood vessels and lymphatic vessels are in the dermis. And those blood and lymphatic vessels, although they serve an important role for keeping our skin healthy, they have the unfortunate side effect that they connect to all the other parts of our body. And so when melanoma or other cancer cells get inside of those, they have the potential to be able to spread to lymph nodes or even to other distant parts of the body. So that's how that process, which we call metastasis, the spreading of a cancer from the place where it started to a different part of the body, like a lymph node or the lung or the brain or somewhere. That's how metastasis is able to happen. So that's why invasion is such an important thing that we look for in melanomas, because once there's invasion, then there's the potential that the melanoma could maybe spread to a different part of the body. So all the cells we're seeing here, these are all invasive melanoma cells. Well, almost all of them. These little tiny round cells here, those are actually lymphocytes. They're white blood cells, immune system cells that are here kind of trying to attack the cancer and fight against it. Unfortunately, they're not being totally successful here. But so these big cells here are the malignant melanocytes. So how do I know they're malignant? Well, one thing, I can look at the pattern in the epidermis and find similar features to what I showed you in the last case, that upward scatter or pagetoid spread. But here I have some extra clues to help me. In the dermis, I'm able to see some other things. These cells are very large, way, way bigger than normal melanocytes should be. And some of them are small and some are large. We call that pleomorphism. So when you have big cells and small cells, very big, dark nuclei, that's generally, those are some clues for the cells being what we call atypical, meaning abnormal in the way their cellular appearance looks. Also, we can see, it's not really probably totally clear here, maybe over here. Some of the nuclei have big dark dots in the middle. Those are called nucleoli. And big nucleoli are a feature that also tells us that maybe the melanocyte is somewhat abnormal. It's not a 100% marker of malignancy, but when I start seeing a lot of big nucleoli, that worries me a little bit. And the other thing that we see in this case, and not all melanomas have this, but they're mitotic activity or mitoses. This little purple thing that looks maybe like a little bird in the sky or a little caterpillar. Here's another one over here, this little purpley black squiggly line. That is a melanoma cell that's trying to divide into 2 and make new melanoma cells. So mitoses are the way that our cells in the body normally divide and make 2. But generally, when we see a lot of mitoses in a melanocyte lesion, that's a worrisome feature that maybe we're dealing with a melanoma. Again, not 100%. There are times where benign nevus can have mitoses. But in this case, we do have several mitotic figures here. And when I see multiple mitoses in a melanoma, it's a sign that that melanoma is probably a rapidly growing one. And it's good that they got this out when they did. So
Jared, let me